Hello, this is Emerging Technologies in Public Health Informatics, and I am Margaret Foster, your narrator. In this lecture, we will cover the concepts of Health 3.0, mobile applications, virtual healthcare, and GIS. In looking at Health 3.0, we will start off by looking at trends that led up to the creation of the idea of Health 3.0. We will also look at some issues and social media uses. This slide shows trends that are in and trends that are on their way out, such as Facebook is in and personal homepages are going out of style. In addition, RSS feeds are almost unheard of now, where tweets are everywhere. Look over these trends and see which ones you are following. Now let's look at the progression from Web 1.0 to the mobile apps. Web 1.0 were the traditional websites where there was no input from users. Creators would put up a website that was flat and just provided information. Eventually, Web 2.0 took over, where readers could start to edit and add information to websites. Web 3.0 brought in the idea of improving sharing between programs. Now, non-programmers could create new programs with some easy software. Now with mobile apps, the phone captures data or information about the user based on location or other information and posts information for that user. In applying these same trends to health, Health 2.0 took ideas of Web 2.0 and applied it to patients, such as patients communicating better and more frequently with their providers through websites and posts and other things. In Web 3.0, information is being captured from the user, such as vital signs, blood sugars, and others, and is posting the information through appropriate channels so that their provider can keep track of what's happening with their patient. Quickly, we can see that there are many stakeholders involved in this process. First, the patient and the family must be using the technology on an everyday basis without much training to be needed. Insurance companies, hospitals, and other providers need to be using them, as well as reimbursing the clinicians or professionals that are helping these patients, who also need to be trained in using the technology in order for all of this to work. This slide provides a glimpse into the complexity of designing these types of applications. You see that patient safety, efficiency, quality, and cost are considered, along with what the patient needs and what the best evidence is showing us about their condition, which is right there in the middle. Now let's look at some issues that are affecting Health 3.0. One of those issues is the information explosion. Every 72 days, print information doubles. To put this into perspective, think of all the print information available right now. In 2 years, there will be 1,000 times more than we have right now, and everyone is contributing, from Facebook posts, tweets, emails, blogs, comments to sites, journal articles, magazines, news stories, Wikipedia entries, and more. In addition to the amount of information being created, the amount of available storage has not been able to keep up. And this diagram from The Economist shows the forecast of where information is going. While these new technologies can help to improve communication issues, they can also create new ones as well, such as how does a small office track questions and responses to patients? What about reimbursements for their time? There could also be issues with identification as many people online like to post things anonymously or have multiple personas depending on where they're at online. Finally, let's consider the effect of social media. It's everywhere. There are over 800 million Facebook users and over 500 million Twitter accounts. There are many uses for these two products and many other social media in healthcare, such as asking questions, sharing experiences with other patients and providers. There's also helping to create a global market for medicine because consumers want to compare their treatments and options, such as prescriptions and surgeries, with other countries. In addition, companies have started to pop up that allow patients to order labs for themselves. Next, we will look at mobile applications, looking at the characteristics, the meaning of ubiquitous computing, current technologies, and a few examples from public health applications. This first slide looks into why have mobile applications become so important. First, they are embedded. Many networked devices are integrated into our environment as so many of us have them. These devices are context aware, meaning they can recognize you and where you're at, your situational context. For example, they are location aware through GPS positioning. They can be personalized to meet our own needs. They are adaptive as we change the applications that we want, and they can anticipate what we want without us having to go out and seek new applications. So what does ubiquitous computing mean? This is a change from having a desktop model on your desk that is immobile and limited to just a few people, to everyone having the ability to do some type of information processing, and it's integrated into our everyday objects and activities. This is available because the objects are unobtrusive. They are human-centric, meaning we can easily hold them in our hands, put them in our pockets, they don't get in our way. They're pretty dependable and secure. They're seamless as far as providing good communication and computing infrastructure. And they're also dynamic and massively distributed. This slide shows a variety of different technologies that have been added to work with your mobile phone. In clinical medicine, we've seen stethoscope enhancers and ultrasound attachments. We have tools such as barcode readers you can link to at your computer desk, or perhaps even your personal health record if you created those through Microsoft's Health Vault. We're starting to see plugins that test for different things, such as air pollutants, toxins, ultraviolet sunlight, pollen, and more. Lastly, let's consider one public health app that's available, called WISER, which stands for Wireless Information System for Emergency Response, and is produced by the National Library of Medicine. This allows first responders to determine what hazardous chemical has been spilled or released into the air. It can also tell them what the adverse health effects may be and provide containment or treatment advice, and is freely available. Our next topic is virtual healthcare. Here we will focus on two main subjects, virtual visits and virtual worlds. First, I will provide an overview, some of the different examples, and then we'll look into some public health implications. So what are virtual visits? These are visits with a healthcare provider that are done virtually, such as through email, chat, video chat, and others. Insurance companies such as United Health, Aetna, Cigna are starting to reimburse for these communications. They can be used to refill prescriptions, provide test results, referrals, or follow-ups on chronic conditions such as diabetes, asthma, or high blood pressure. companies have started to pop up that match patients and physicians. Most of these companies say that the doctors will review your history, answer questions, diagnose, treat, and prescribe medication. I've seen fees vary from very little, such as $10 to talk with a nurse, to $45 to $95 to talk with a doctor. There are 3 examples listed here of companies that do this: the Now Clinic, Sherpa, and American Well. So what are some of the implications for public health? First, there's a decrease in the cost of visits, as the patients did not have to travel, and doctors can go from one patient to the next fairly quickly. There's an increased ability of healthcare providers to monitor patients, such as they can meet with a patient more often. There's also has been shown a reduction in mortality for chronically ill patients in one study that looked at a group in the UK. The chart shown here shows costs per patient per year and the difference between the amount of hands-on care they receive. You can see that virtual visits are much more cost-effective. Now we will look at virtual worlds. What is a virtual world? Virtual worlds combine forms from the physical world, such as places, people, or objects, with information and the ability to interact with the others. We're going to go over some examples in just a minute. This slide helps to put virtual worlds into perspective by looking at a variety of actions that you may do in a day, with a column for the physical space you may do this in, or the virtual space, and in the middle, a virtual world where you might do this action as well. Let's look at shopping. For shopping, maybe you go to the mall or the grocery store. A virtual space could be eBay or Amazon. A virtual world could be the MSN virtual model, where you put in your measurements and try to make the model look like you, and then have it try on actual clothes from a variety of different stores. Another example of this is entertainment, where maybe you go to the movies, concerts, other places. Virtual spaces could be YouTube, iTunes, and others. A virtual world would be something like World of Warcraft. Although it is an imagined world, it has physical characteristics that cannot be broken, and you can still interact with others here. So what are some characteristics of virtual worlds? These worlds are networked and simulated, where people can have synchronous or asynchronous interactions. There are usually some type of physical rules, although they do not necessarily apply to the rules of our world. Users can create avatars or identities. In some cases, users can also create objects, store information, and other applications. The Texas A&M Health Science Center has some spaces here, as well as Texas A&M University. There are a variety of uses and implications for virtual worlds. I've listed a few here. Within the lecture video area, there are several videos that I added so that you can watch some of these in action, including training for disasters and more about the Texas A&M University area within Second Life. Now let's look at GIS, or Geographic Information Systems. GIS is designed to bring geographic information together with other information and consists of hardware, software, data, and users. The information is layered on top of each other, with the data coming from a variety of sources. Primary being those that were gathered firsthand, and secondary that were collected and then mapped to match the base map. This example shows topography with roads and boundaries on top of it, structures and services, population, and then health information about that population. Each piece of data will have geometric data and attribute data, each of which could vary in a variety of ways. The geographic data could apply just to one point, a line, an area, and so on. The attribute data could be qualitative or quantitative. GIS is not a new idea. For example, the famous John Snow created maps to help pinpoint possible sources of cholera. He noted the number of ill at each location with bar charts, and this helped him to determine which well was causing the most sickness. GIS data does not have to be limited to Earth coordinates. They could also help to map out the human body, a genome, a building, or even another planet. Of course, one way that GIS is affecting everyone's lives is through the use of mobile apps. Location-based software has become very popular, with the top chart here showing the total number of iPhone apps that were based on location. In addition, we can see that there are many GPS positioning software that can be combined with a variety of interests for the Android. Here I've listed a few public health apps. There are many more listed under Resources and References for Week 11. The Global Health Atlas provided by the World Health Organization allows you to view a variety of health issues across the world. ToxMap, which is provided by the National Library of Medicine, provides up-to-date environmental health information. In addition, FEMA creates disaster maps showing hazards that may occur, as well as data about situations or emergencies that have already happened. A variety of GIS software is available. Students have access to ArcGIS, which is available on the OAL computers at the Medical Sciences Library, as well as some others. You can also visit Maps and GIS on the second floor of the Evans Library for more assistance. In conclusion, the future of public health informatics is wide open. There are many exciting new ideas, concepts, and technologies coming out. You just need to look around to see these happening. With the variety of possibilities for gathering data, public health surveillance is sure to change over the next 5 to 10 years. So keep your eyes open for the next big thing.